All right, as you are shown by the tiny box at the top, that we are recording and transcription services of this hearing have been turned on. If you do not agree to be on camera or transcribed, please exit the hearing at this time. Okay, with that, we will go and we are going to pick up with questions by Mr. Lazarus.
Great. Thank you, Alicia. Good morning, Stephen Lazarus, OHS staff. So I know we talked about the CHNA that was submitted in the record, and that was the 2022 or 2023, I believe. I believe there's a newer one that was put out. Would you submit that as a copy, as a late file too, into the record?
Yes, we can do that. Steve, this is Jen Fusco, I'm sorry. We have pulled that and looked at it, so I already have a copy and we can send it over to you. It's largely consistent with what was in the prior one, but I can submit that to you.
Perfect, because I think that'll sort of line up with the timing we discussed today.
The 2025 Stanford, it's the Stanford Darien one, right? For Stanford Hospital is the one you're looking for?
Yeah, the Stanford Health System one, yep.
Right. Okay.
Well, one of the things we've talked about, and you submitted a copy of the hub that we included into the record. I wanted to see if we'll give you an opportunity to sort of talk about that a little bit and sort of specifically see how that relates to this proposal. Which parts of it that you think are appropriate?
I don't know what it's about.
We have the on there. Just bear with me while I get a copy of it. See.
Just looking for some sort of highlighted discussion that'll sort of tie it to this proposal.
Exactly, and it was definitely, I'll get a copy of it.
Sure, take your time.
Okay. Find it. This is why I print everything. Okay. But I can't tell you if you, here. It's going to be in your testimony. I can pull the report out, but it's that Region 1 priority report.
Oh. Yes, likely that's it.
Here. That's where we had it. There you go. I wasn't in here. Sure. It's in the stuff you didn't. This is in the stuff you found.
Okay. Oh, that's not
here we go. Yeah. So what was the stuff that we looked at? Remember?
Yep. Okay, so I have it in front of me. This is Cassandra Ruella. Do you want to just highlight your question one more time now that we found the data?
Sure. I was just looking to have you sort of talk about how this supports your proposal, any specific parts of the hub, since we included into the record.
Yeah, so the focal points of the hub for us was that according to the 24-25 regional priority report, which was Region 1, escalating mental health needs, particularly among young adults, have been identified, pervasive substance misuse issues, and systemic gaps that create barriers to access across all levels of care. So one of the biggest things was that gap in access, and if we can provide that all in one continuum, there will be no gap for us. It'll be streamlined. The identified statements from that report was that for individuals managing co-occurring disorders, the care system can feel more like an obstacle than a lifeline. Focus group participants stated that referrals are becoming more of a barrier than help, and people who want to get better are stopped by every system that they interact with. And for mental health care, there are long wait times for therapy and lack of culturally and linguistically appropriate care. And all of those things support what we are ready, willing, and able to provide.
And your facility would also focus on the young adults?
Yes. So right now we will be serving 18 and over. That's what we are working towards at inception. And we are not against serving younger than 18. It will be all a reassessment consistently based on needs of the catchment area. We also,
lastly,
I'm sorry.
Go ahead.
I'm sorry. We also, because we're already Joint Commission accredited, and so we will continue to work toward that in the Stanford location. There is a competency requirement and standards that we currently meet for culturally and linguistically appropriate services. We will be looking for Obviously, nothing is guaranteed because, again, it's an art, not a science, but preferential focus will be placed on bilingual staff members based on the catchment area being largely Spanish speaking.
I assume I'm just going to state the obvious. I assume your
Yes.
bilingual will be Spanish.
Correct. That will be the preferential focus.
All right. Lastly, you had mentioned today what differentiates your facility from the other providers in the area is the fact that you offer, even though the others may be licensed similarly, that your facility will offer services that are comprehensive and to get these services together are not being offered by any other facility. Can you talk a little bit about that and just sort of talk about the advantages of that compared to some of the other existing providers?
Yes, absolutely. So what we would be looking to do is providing an integrated continuum of care. And so what we know to be true, I've referenced this previously in this hearing, but I am a licensed professional counselor. I have over a decade of experience treating substance use as well as mental health at all levels of care at this point. And what we know is that it's a chicken or the egg type of mentality. We get away from the substances and our mental health issues spike up. Because of our mental health issues, we want to move back into substance use, and it's this consistent cycle. And the comprehensive integrated focal point of Paramount will allow people to address both at the same time. In real time, when triggers come up and they are leaning towards mental health or they are leaning towards substance use issues, our staff can lean with them. And there's not going to be any contraindicated care going on. For example, I have seen and I've worked with patients who have had experiences at other levels of care where they have exceptional trauma backgrounds. They get themselves clean. They are in a substance use program focused solely on substance use. Their trauma becomes triggered and they can't necessarily surround that in an enveloped way that will help them as a whole person. We're looking to eliminate that concern. Additionally to that, if you look at the other providers in the area, which I'm sure are wonderful providers, we have a table of all providers in that catchment area at this point, and there is not one provider in that catchment area that provides every level of care we're talking about for both mental health and substance use primary diagnoses. And so if we look at the entire person, which is what we're looking to do, then we can have an entire recovery.
And your staff, will they be sort of licensed in both mental health and substance abuse?
So we will have master's level clinicians running the clinical programming. That would include potentially associate licensed or fully licensed marriage and family therapists, social workers, professional counselors. We also will have recovery coaches on staff. That's listed in our CON application as well to identify the peer recovery support. And so I think the culmination of our staff's entirety and the collaboration that our staff will have internally, which is demonstrated in the current care that we give, is that substance use and mental health providers will work collectively to provide the care effectively for those clients.
Thank you. I think that wraps up my couple of questions. Wasn't sure if any other OHS staff have any follow-up. Thank you, Attorney Novi. You can.
Attorney,
All right.
can I just ask a question, Attorney Novi?
Sure.
Jen Hutsko, would you like us to do as a late file? There was some discussion about, in several questions about existing providers that had been approved sort of since some of this data came out or, since CCHNAs were done. Would you like us to sort of update our list with those providers as part of the late file?
Yes, we can do that as late
Right.
file 3.
Will there be late files 3?
3.
Attorney Novi?
Yes. Okay. All right. So I'm going to ask you, Attorney Fusco, do you have any follow-up questions you'd like to pose to your witnesses?
No, I think we're good.
All right. So at this point, we'll move to the public portion and then go back for just a reiteration of late files, when they'll be due, and in closing statements. For those of you who are joining us or who have tuned in after we first explained the instructions, this is the public portion of the hearing. I do not have any signups for the public portion of this hearing. So I will not read through the entire instructions. However,
Okay.
I will make my favorite statement, which Attorney Fusco, you will hear many times if you're in my hearings. If you would wish to submit written testimony in lieu of making a statement today, you can email us your comments at concomment@ct.gov. Again, that's concomment@ct.gov. We will be accepting emailed comments for 7 days from the date of today's hearing. So we will take those comments through January 20th, the close of business on that day. You may also mail us your comments. However, with the mail time, if it does not reach us in 7 days, it would not be, it may not be considered. Therefore, we would ask that you email us for fastest delivery. Okay. All right. So at this, we will go to, let's go over the late files and establish a due date for them. Does anybody want to read the late files or should I read them?
I can read it and see if we can have it. So I have 3 late files listed for today. First one is the readmission data in the PSA. Second is this.
Okay, I'm sorry, Steve. Jen Fusco, do you want that in the Connecticut PSA, the total, or are we just focused on Connecticut or sort of Connecticut and New York catchment area? Just Connecticut?
Just
Okay,
Connecticut.
just
So the
Connecticut.
proposed PSA of
In
Connecticut
Connecticut.
towns. Yes.
The CSA, that's what you could.
Connecticut
Maybe that's what we
service
were
area.
talking about. Maybe that's.
Yes, the Connecticut service area.
It's a new word, a new acronym. I'm sorry, Steve, go ahead.
Nope, that's okay. The second is the 2025 CHNA for Stanford Health System.
Yeah.
And the third is the updated list of existing providers in the PSA. That includes any recent approvals from OHS over the past, since the application was filed.
And consistent with the application, our plan would be to limit that to sort of what we'll call the primary service area of our
Yes.
catchment area, right? So
Mhm.
Stanford, Greenwich, Norwalk, Darien, New Canaan, that immediate area. Okay.
Yeah,
Okay, perfect.
All right, Attorney
Thank
Fusco, what do you think would be a good timeline to get that back to us?
2 weeks, okay, or? is
Would
that
you
enough? A
like to
week?
do January 30th by the close of business,
Wow.
January 30th? Because there's a holiday in there.
Let's do January 30th. We could probably get it to you sooner than that, but.
No problem. And if you do need additional time, please just, send a request for additional time and we will consider and go ahead and take care of that.
But we should be able to do
Yeah,
that.
no, this is very simple.
Okay.
Okay, so we will give you to the close of business on January 30th, 2026 for the late files and written responses. Are there any additional questions or concerns about these late files?
No.
All right. So at this point, we will move to closing statement or argument from the attorney.
Sure. Thank you, Hearing Officer Novi, and I'll keep this brief. You've heard a lot today from the people who it's more important for you to hear from, and I thank you for taking the time to listen to us. And on behalf of myself and my client, we hope that the testimony today has given you a better understanding of sort of the critical need that we see for additional outpatient behavioral health services in the greater Stanford area, and how Paramount's proposed outpatient center in particular is going to promote equitable access to high quality, cost effective care for those Connecticut residents whose needs are going unmet for various reasons. In my experience, it's been, and I've had a lot before OHS, it's been a consistent priority of this agency and of existing providers on the continuum to enhance access for behavioral health services. It's always something that we're talking about doing it at all levels, across all diagnoses, inclusive of all payer types, and for the benefit of all Connecticut residents. And if you look at the letters of support that CC was referring to before, they speak to, from other behavioral health providers, they speak to this growing need for a structured, high quality step-down service that effectively bridges that gap between the high level intensive, inpatient and residential levels of care and outpatient patient levels of care. And it's a particularly acute need for individuals with these complex behavioral health needs, including those who have substance use, mental health disorders, and in many cases, co-occurring disorders, right? These are patients who require local integrated outpatient follow-up care so that they will stay engaged and they won't relapse and be readmitted to higher levels of care. And as we've said in our testimony, locating a program in Stanford directly supports these high acuity, high risk clients in accessing their continuing care. There's a lot of data in the CON and then the testimony and responses to hearing issues, and I won't go through it all, but I think some things that really struck me were, if you look at OHS's own statewide healthcare facilities and services plan, there's a substantial unmet need for mental health services in Connecticut, including in the Western and metropolitan planning regions, which this proposal will help to remedy. And what Cece was saying in her testimony before is the plan authors are saying even those numbers they believe are underreported, and that enhancing and increasing mental health access should always be a priority. I pulled that language straight out of the plan, so I think everyone's in agreement on that. If you look at the SAMHSA data, it's talking about how a third of individuals, these complex patients who have co-occurring substance use and mental health disorders, aren't receiving treatment, and less than 20% of those who do get treatment are receiving that integrated care that Cece just explained beautifully, right? That whole person integrated care that's going to make the difference when they have issues on both in different types of behavioral health. Okay. And then, if you look at the priority report, we just talked about escalating mental health needs. And this is a report focused directly on this region, right? The greater Stanford area, lower Fairfield County, escalating mental health needs, pervasive substance misuse, systemic gaps that create barriers to access across all levels of care. This proposal is going to help remedy all of those issues. And the CHNA speak for themselves as well. I know we need to get you the updated one for Stanford, but I can tell you that I've looked through it, right, recognizing that we had used the prior one in the CHIP, and progress has been made, but you're seeing a lot of the same issues. This is obviously not a problem that's going away as we chip at it and try to solve getting more services for the people who need them. I'm not going to take you through all the decision criteria, but I think you can see that we've determined clear public need based on the evidence in the record. Cece said a couple times a sentence I like, which is determining need is an art and not a science, right? And there's not a mathematical formula for doing it, particularly when you have patients coming from different referral sources, right? This was a project that was born out of a need within Paramount that they were seeing in their Haddam facility to service their own patients who wanted step down care, who, are coming from far away to go to this beautiful facility in the woods of Haddam, Connecticut, right? And who are going back and seeing that they don't have it, and they wanted to be able to provide those services. And then they're realizing there are a lot of people who call who they can't let in because they need outpatient, not inpatient, or they have a primary mental health diagnosis and they can't treat that up in Haddam. So more people will come down. And then as you start to look at the market, and all of the data and evidence that's out there shows that there's just a ton of unmet need. I mean, we were talking about tens of thousands of people who need care, who potentially report not getting care with various issues, people not getting optimal care, not getting long enough care, not getting integrated care, and the list goes on. So, I think we've shown that there's clear public need. I know there were some questions from OHS about unnecessary duplication of services. I think given that unmet need, the services won't be unnecessarily duplicated. And if you look at those letters, particularly, for example, one from a provider like Liberations, right? There they are. We're all going to work together in the market, and they'll send us patients, and we'll send patients if we need to get people the care and treatment that they need. We talked a little sort of the big three: quality, cost and access. Cece talked a bit about the Paramount program, the high quality care. You heard Joseph, speaking about what the program was like for him. And I think he said it better than any of us could possibly say it. It's a wonderful program. It's a program that, Chris Bartler told you was born of his experience, which wasn't a positive experience, and that really looks to work in an individualized manner with clients to make sure that they're taken care of, and that they're moved along in a continuum so that they recover, and that they stick on that journey to recovery, right? So the quality is there, the benefits of stepping down in the same program that you'll see throughout our Cece's hearing testimony, access. Obviously, we've talked a lot about there not being a like provider that has the levels of services, the integrated plan for the different diagnoses, but access for Medicaid patients is critically important as well, right? It's going to be 11% of the patient population, which in my experience doing many of these CONs is is a solid number. And I think there's a lot of patients down in that area with Medicaid whose needs aren't being met, who we can serve. I think there's going to be, I think it was what, 9 or 10% for
9%.
uninsured. Same thing. You know, they've got this scholarship program where they reinvest 5% of their revenue in providing charity care scholarships for those who need it. So this is not, you know, someone who's just going to come in and serve, you know, only a particular type of patient. It's going to be access for all. And obviously, you know, we didn't focus a lot on cost effectiveness, but, you know, outpatient care in a freestanding setting at a lower level of care is obviously less expensive than going to an emergency department when you're in crisis, than having to go to, you know, to be admitted or readmitted to inpatient because you didn't get timely outpatient care because it wasn't available, or it wasn't, you know, it didn't work for you. And then just finally, you know, patient choice, you know, you've heard it, Paramount's patients are asking for services in Stanford. It's where they want to go. It's where they can most easily access it. Paramount's coming in, and although they'll work with a bunch of providers, they're not part of any system. They're not affiliated with any other providers. So it also helps with the diversity of providers, right? It's an unaffiliated and new option in the area. So I think that, you know, before you today, you have a company, and Chris spoke at the beginning of the hearing, you have owners who have a personal interest in ensuring that Connecticut residents have access to the highest quality, individualized behavioral health care within their communities. They know that kind of without this ease of access and continued engagement, sustained recovery and mental wellness are jeopardized. So, you know, not to use a cliche, but they are ready, willing, and able to build this facility and to start meeting that unmet need. And we urge you to allow them to do so. So thank you again. And if you have any questions, let us know.
All right. Thank you, Attorney Fresco. I would like to thank you and your applicant for attending today's hearing. This hearing it is now 11:35, and this hearing is hereby adjourned, but the record will remain open until closed by OHS at a later date. Thank you, everybody, for attending. Have a nice day.
Thank you so much. Take care, everyone.
Bye.
Bye-bye.